A 2017 study found that alcohol is the most used drug by older adults. In fact, 65% of people 65 and older reported engaging in high-risk drinking. High-risk drinking was defined as drinking more than the daily guidelines by the National Institute on Alcohol and Alcoholism. And so what are the daily guidelines? I'll tell you at the end of this video. Research published in 2020 found that increases in alcohol consumption were greater for people 50 years old and older than younger adults. Why is this topic such a big deal for older adults? That is exactly what I'm going to address in this video. I'm Dr. Regina Koepp. I am a clinical geropsychologist where I specialize with older adults and families. I also am founder of the Center for Mental Health and Aging, which is your go-to place online for the mental health care of older adults. Each week, I share an important mental health fact and tips around mental health and aging. Okay, so let's talk more about alcohol use in older adults. I'm going to review the 3 reasons it's so important to talk about alcohol use among older adults and what the daily recommendations are if you are drinking and you're 65 and older. And then if you'd like more information on diving deeper into alcohol use among older adults and how to help your older loved one get engaged in care, or if you're an older adult yourself and you'd like to get engaged in care, check out the show notes for lots more information. Let's get back to alcohol use in older adults. So what are the 3 reasons that alcohol use is so important to be mindful of for people 65 and older? So our body is much more sensitive to the effects of alcohol, and that could mean that we experience a high or get drunker faster. And that could put us at risk of falling, and falling can put us at risk of breaking something and requiring surgery and having a long recovery. It also could put us at risk of car accidents where maybe earlier in your life you were able to drive. At this stage in life, maybe not so much. As we age, our bodies are more vulnerable to some health conditions. And so we really need to be mindful of how we're managing our bodies, right, in terms of exercise and nutrition and what we're putting into our body, like alcohol. If we're drinking heavily, that could cause additional problems to the health problems that we're already experiencing. So it could cause more problems with diabetes, for example. It could increase your risk for heart disease and stroke. It could make blood pressure issues worse, cause liver problems. It can impair your immune system and decrease your bone density and cause chronic pain. You could also be more vulnerable to cancers like of stomach cancer or larynx cancer. Also, heavy drinking and long-term drinking can lead to make you more vulnerable to memory problems or dementia disorders. And then alcohol is a depressant and can cause challenges in the way of mental health conditions like depression, anxiety, and other mental health conditions. So the third point about why it's so important that we're talking about alcohol use among older adults is that medications can negatively interact with alcohol. This is prescription medications, it's over-the-counter medications, and it's herbal remedies as well. So many older adults take a prescription medication or an over-the-counter medication for a chronic health condition. And perhaps that medication or over-the-counter supplement is managing whatever that chronic health issue is. If you add alcohol to that medication, it can cause all sorts of problems. There are some specific medications to be especially mindful of, and I'm going to review them now. If you mix alcohol with aspirin, that's a big deal because it could increase your risk of intestinal bleeding or stomach bleeding. If you mix aspirin with acetaminophen, that can cause liver damage. If you mix alcohol with a cold and allergy medicine, you could be very sleepy and fall asleep in unusual places. The other thing, if you're an older adult taking cold or allergy medications, you really want to be mindful about that as well, because that could create symptoms that look like dementia disorders when they're not. Also, cough syrup. So when you add alcohol to cough syrup that could, or laxatives that could increase the amount of alcohol in your system, even when you're not intending it to. Also, sleeping pills and pain medications, when you mix those with alcohol, they can be fatal. So if you are concerned about your own medical conditions and the medications that you're prescribed and drinking, please consult with your physician about next steps and maybe troubleshoot with your physician the pros and cons of drinking, understand how much drinking is safe for you and your particular body based on the medications that you have and the medical conditions that you're managing. So what are the recommendations about how much alcohol is safe for older adults? This is a loaded question. So it's hard to make one determination about how much alcohol is safe for all older adults. Everybody's body is different. Everybody has different medical conditions. Everybody has a different ability to metabolize alcohol. People are on different medications. So there is no one size fits all answer here. So the National Institute on Alcohol and Alcoholism recommends that if you're an older adult, 65 and older, and you are not currently taking medications and don't have major health problems, that you drink no more than 3 alcoholic beverages a day for men and 2 for women. Women, our bodies metabolize alcohol differently, especially as we age. So it's important to be mindful of that as well. So the National Institute on Alcohol Abuse and Alcoholism also says that those drinking guidelines are actually not intended for people who drive. So if you're planning to drive, don't drink. People who are taking prescription medications, have chronic health conditions, or using over-the-counter medications, and also are not recommended if you're in recovery from substance use like alcohol. So take care of yourself, take care of your recovery. You've worked hard for it. The Global Council on Brain Health, which is an international group of experts who are brain health specialists, recommend that if you want to maximize your brain health in older adulthood and reduce your risk for dementia as best as you can, that you, if you're a man, drink no more than 2 drinks a day, and if you're a woman, no more than 1 drink a day. Everybody agrees that if you are not currently drinking, do not start drinking. There are not enough benefits to outweigh the risks of drinking. If you'd like to learn more about alcohol use among older adults, I dive deeper into this topic on my podcast. That's The Psychology of Aging, found on all the major platforms for podcasting. I also link to it in the show notes down below. And if you'd like more information for yourself on cutting back or stopping drinking, or if you're concerned about an older adult who may be drinking too much, there are also resources on the show notes of this episode, and the link is below this video as well.